Good afternoon, everyone, and welcome to our session on pathology. I'm Garmia Yadav. I'll be a moderator along with Dr. Tejasvi for this session.
Hi.
So our first speaker is Dr. Anurag Sharma. Dr. Sharma is a Chief Dermatology Fellow at Cleveland Clinic, Ohio, and he's the APCP Residency, Cleveland Clinic, Ohio too. And he needs no introduction. So Dr. Sharma, over to you.
Hi guys. So do we have questions? How do we proceed?
So in the initial, so first we'll be introducing you, and then you'll be kind of speaking about your story for the first 20 minutes, and later on, once all the speakers introduce themselves, tell their stories, we are going to have a question answer session.
Okay, sure. I love to speak about myself, so thank you for giving me the opportunity. So I come from India. I did my med school there. I finished in 2011. Then I finished my MD in pathology from Kainth University in Orissa. Thereafter, I practiced for 2 years in India. I practiced in a private lab, and I learned a lot, in that work environment. Then I practiced as an assistant professor for 6 months. Then I came to Mayo Clinic to do a postdoc research fellowship in pathology. Then I applied for my residency. I matched to my top choice, which is Cleveland Clinic. And when I was like ranking my programs, I had, I wanted to do a derm path fellowship from day one. So I ranked my programs based on which programs have a strong derm path fellowship. And I eventually matched into the derm path fellowship that I always wanted. So, it was just like, destiny. Some people say by God's grace, I'm an atheist, so I don't like, but whatever you call it, like things just fell into place for me, and I've been really fortunate. Only thing is that I never thought of myself as being a number 2 player. I was always a number 1 player. So even when I was failing, I was confident about myself. And there have been a lot of instances where I failed miserably. And I actually started taking screenshots of every time I was not able to clear something. So my screenshots of failure are with me, because somehow I knew that, someday, even now, like I take screenshots of my failures, because I just want to, I want to remember where I'm coming from. I want to remember my roots, and that helps you stay grounded, and I think I'm doing okay right now. This is still not the best that, I can do. So, I just remember my past. Every time I talk to somebody, I put myself in their shoes again, and I see what they would have wanted, like what I would have wanted from them. And I try to provide, the juniors the same, answers and same kind of help that I would have wanted from my seniors. So that's my motto. And, that brings me here to the session. I would have wanted somebody who has been through the journey to tell me, what to do, what not to do, and answer my questions most importantly. So I'm basically here to answer questions, because I know questions can be very different based on people's circumstances. And the one thing that I believe about USMLE journey is that, all like 121 of us, all of us have a different story. We have a different journey. There is no one true way to, achieve success. There is not one single thing that you can do to be successful. So I believe that even when we are advising people, and that's what he said, like mentor of mentors. So the new mentors who are coming up, I tell them that you do not tell them that your way was the best way. You talk to them, find out what is the situation they are in, and advise them based on that. And I also get contacted by other people who are not interested in pathology. It's not that I always try to push people to apply to pathology and to get interested into pathology. I always try to advise them, based on what they want. You should advise people based on what they want, not based on what you want, right? So I think that's pretty much it. And we can hear from other people now.
Thank you so much, Dr. Sharma.
Mhm.
Our next speaker is Dr. Megha Laohori. She is an oncological surgical pathology fellow at Memorial Sloan Kettering Hospital. And she's also an AP at Mount Sinai West Morningside. Dr. Megha, over to you.
Hello guys, hi. I am Megha Laohori. I'm from Jammu. I did my my medical school there, and then I was doing my residency in pathology over there. So I started preparing for USMLE in my second year onwards, and in my final year I took the step 1, and then after I took my MD exams, I came here and took my step 2 CS and step 2 CK. And I think, and in that time I was also doing observerships, a couple of observerships. I did one observership here at Sloan Kettering and another in Boston. So I think the most important thing to, and I did my residency in AP anatomic pathology at in New York. It's a hospital called Mount Sinai West Hospital. And after that, I did one fellowship in cytopathology here at Sloan Kettering Cancer Center in New York. And after now I'm doing my oncologic surgical pathology fellowship. I'm on H1 visa. So the most important thing is to know about pathology before you're applying, what it's all about, what you want to do, and why you want to be in it. Because it's very different from everything else. You really don't see patients unless you're doing some procedures in cytopathology, etc., or some apheresis, etc. You really don't see much patients. So that's the most important thing to ask yourself. Why pathology? Do you really want to be in it? Because the exposure that we get in medical school is really not enough. It's still more than what they have here in this country, but it's still not enough to decide whether or not you would like to do it for the next 40 years of your life or something. So it's important to find that out, and to know what people do in pathology in a day-to-day life, because the way pathology is practiced in India versus the way it's practiced here is really different. I mean, the theory is the same, but the way the case volume here is tremendous. It's very busy here. It can be very busy here. There are some places where it's not so busy, but mostly pathology is a very busy service in most of the hospitals. Like in my residency, it was really busy, and in my fellowship, it's also very busy. So I think you should not expect that, oh, I'll go into pathology and it will be an easy life, I'll come back at 5 or something. No, that's not going to happen. The second thing is to know that there's always the fear of litigation. There's always something that you might have missed 5 years back or 10 years back, and now it can come up to you. So that is also very important to know, and that affects people's personalities. Like I've seen a lot of people who've been paranoid about, oh, am I doing this right? And then they show their cases to like 5 different people. It happens. It's a very real life practical situation. So you really need to know why you want to be in it and what are the pros and cons of being in pathology. So whoever you talk to might in pathology will give you a very good, like, oh yeah, it's very nice and all this, but you should know what are the cons of it before you go into it, because the people who've already been here, they have decided based on their personality, right? So you guys have to decide based on your personalities whether you really want to be in it or not. It's really good. It's very you have to study a lot and you have to see a lot of cases. It's very satisfying by the end of the day, but you have to know whether or not your individual personality can click here. So that's that. And you should not expect like an easy, it's not like India. Like pathology here is very, very, like the case volume is too high. So it's not like that. And then maybe you can also try and find a mentor, someone like Anurag, who has been working with people and other people as well. Like if you want to be in a certain area and you know that there are pathologists there, or there is already a residency program there, so find a mentor, try and work with them, observe how they, like there are observerships available in like a lot of places. So see how they work, whether or not that the setting suits you. And every program is different. Like university programs are different, community hospitals are different, then the bigger centers have their own entirely different curriculum. It's not like the bigger centers might be the best, or some programs are toxic, some are really good. So it's a mixture. You have to decide like what you want to do, where you want to go. So I can only, I mean, that's what I can tell. Like from my experience so far, it has been that it's very varied. So decide what, and plus the area where you want to live in. Like in New York, we pay a lot of taxes, so we don't really save as much. So, and the taxes are high, the rents are high. So those kind of things. But then in New York, you also get a lot of like hands-on experience. I mean, other places also have a lot of hands-on experience, but then in New York, every hospital is really busy. So you get a lot of hands-on experience. And by the end, you have to know like what kind of setting you want to be in for the next 4 or 3 years of your life, whether it's an academic or it's a community hospital, and then where you want to do your fellowship, which subspecialty you want to be in. And the pathology market has also changed over the years. Like I think when Anurag and me started applying, we were like, oh, we don't know where the market is going to be, whether or not we have to do 2 or 3 fellowships. Will we have to go back to India? But that's not the thing right now. Right now, the market is really good. So people have been getting jobs after one fellowship. Like I know a lot of people who've not even done fellowship, and they just went into a job straight ahead. So things are different right now, and it's looking better. Plus there is digital pathology. So there is the option in, like right now, radiologists can work from home. They can just see their cases and sign out their cases. In future, pathologists can also work from home. Like a lot of like in my residency, they started that. So there were a few attendings who like 2 days a week, they would work from home. So that was possible, but that's not a nationwide thing. So but that is happening, and like all the major pathology bodies, they are supporting it in a big way. So that will happen, and that's a good thing to like look forward to if you really want it. If you're like, I don't want to go to work every day, or I don't want to commute every day, so that's also a very good thing. Plus you don't really have to be on calls in pathology, mostly, except if you are like on CP or something. In residency, you have to be on calls, but after that, you're not really working over the weekend. So that's a good thing if you're like that. But the most important thing is like which subspecialty you want to focus on. So because that also will drive your quality of life. Like I am doing a search path in cytology, and when I look for a job, it will be a general market. So that has a different, its own different things. For example, Anurag is in derm path. So that is its own. Like in derm path, they really start very early, right? They start like at 6 or something. They are done by 2 or 3, but they really start at the pace of working in derm path is also very different. Like I was in cytology, so the pace of working there is very different. So people have different personalities in different subspecialties. Right now, as you're going into this whole USMLE thing, and you're like, I don't know, pathology seems like one personality type, but it's not like that. You will go into subspecialties, and there are multiple different personality types, and you will acquire traits of each of them. So you have to think about it. And the most important thing to ask is like whether or not this suits me. Once you decide, find a mentor and try and do some research, do observerships. If you are good enough, smart enough, you will definitely get into it. But the most important thing is like to start. The most important thing is, do I want to do it? Where do I want to do it? Why do I want to do it? I think that's it for me right now, but I'll be here. So ask any questions after I think Anurag Khanna is done.
Thank you, Dr. Laohori. I would move forward with introducing Dr. Anurag Khanna. Dr. Anurag Khanna attended medical school at Maulana Azad Medical College, New Delhi, India. He's currently a third-year resident in pathology core program at Emory University, Atlanta. In addition, he will be doing fellowship in hematopathology at Emory University in 2024-2025. He loves teaching and engaging with medical students and actively involved in Emory Medical Laboratory Students Program. Dr. Khanna strongly believes in the power of social and digital media for teaching. To that effect, he just recently started his YouTube channel where he talks about various pathology topics and regularly posts on his Twitter handle. Welcome, Dr. Khanna. The floor is all yours.
Thank you so much. Can you all hear me? Okay, great. So yeah, so I'm Anurag. I'm not Anurag Sharma, Khanna, as I've been pretty commonly confused. I've received some of Dr. Sharma's emails as well from some of my colleagues. So I have to remind them I'm not the Dr. Sharma, I'm just a small Anurag Khanna. So, I mean, I did my medical school from New Delhi, and I was like the typical confused medical student, like most of us are, like what to do. We all enter medical school with, I want to be a cardiothoracic vascular neurosurgeon, the highest possible thing that we have to do. And then, and in India, I mean, and we are always, told that the clinical subspecialties are like, that's what you have to do. That's other specialties are not as probably good as clinical or something. So my journey was also on that path initially. So I initially wanted to do clinical, and I got into an ophthalmology residency in India itself. I worked there for 6 months. Didn't like it. I thought it's probably just ophthalmology that I'm not liking. So I gave the Indian entrances exam again. I got into pediatric surgery. Didn't like it again. Because, I mean, then I left it again. Then I joined orthopedic surgery. Didn't like it again. Then I left that as well. So it took me 3 tries to residency to realize that I don't like clinical work. I like pathology. I've always liked pathology from second year. I scored well in pathology and it was interesting to me always. But there's always, and I completely sympathize with everybody who've been told that, the clinical fields are the best field and other fields are not so good, but that's totally wrong. It's up to you. You have to first decide whether you like clinical work or you don't like clinical work. And it is totally okay if you don't like clinical work. You're still doctors, you're still helping in the decision-making process. Rather, your decision, especially in pathology, your diagnosis will help drive what is the further treatment and what is the prognosis and what is happening later on. So that journey through residencies took me about 2 years after finishing my medical school. So I finished it in 2016 December. So by 2018 I was through all this chaos, and then I decided to prepare for exams. I gave it by December 2018. I came to the US. I was lucky enough that I knew somebody in the US who helped me get into a research position in Pittsburgh. So after giving my step 1, I came to Pittsburgh for 1 year research along with observerships there. And during my research and observership process, simultaneously, I prepared for my step 2 CK, which I guess is no longer there. But there are other alternatives. But I think mine was the last batch that actually gave the stupid exam that CK is. And then there is the step 2 CS as well CS, not CK. The CS is the stupid exam. The CK is the good exam, although it's still 9 hours long. But so I gave the step 2 CK exam as well during my research, and then I applied. And I got a lot of interviews. And what I did was that apply to all programs if you can afford it. Because in pathology, there aren't that many programs. There are about like 150, 140 programs. And it's not like medicine or other fields where there are like 400 or 500 programs. So if you can apply to as many programs as you can, at max, if your profile is very good, you'll get a lot of interviews, then you can reject a few interviews. But if suppose somebody is not, your profile is not that good, applying to more programs just increases your chance of getting your interview. Scores do matter in pathology. And especially now since step 1 has become pass and fail, so step 2 CK scores will become more important now. Earlier it was mostly step 1 because step 1 covers basic science subjects. So mostly people looked at step 1 more than and this I'm only talking about pathology, not about the clinical fields. So, but now step 2 CK will become important. Although, still they're not expecting scores in the 260s or 270s for pathology, but still if you have a higher score, it will always look good. And then research, it doesn't have to be, that you have to produce publications. There have to be papers that you produce. Just showing that you are involved in a research is also very important, because that gives you talking points during your interview. Like I was involved in basic science research, basically. I was doing cell culturing and all that stuff. But then they ask you in the interview, explain your research. And if you actually know what you're doing, that's a very good talking point. You can expand on it and how, how it has worked for you and how it's helped you in your journey towards pathology. And the other thing is, please prepare for interviews. Don't, go blindsided into interviews. Prepare for interviews anticipate. There are many books out there that have all the questions. Anticipate what questions they can ask you. You should know your CV. That's very important. If you don't know your CV, then that's a very big red flag. And they can ask you anything from your CV. Every publication that you're putting there, every experience that you're putting there, you should have an answer to explain what you did during that experience. And in detail, you should be ready to talk about it for as long as possible. And then, yeah, as Dr. Laohori also mentioned, that pathology now is, I mean, in the US especially, it's very subspecialized, especially in the bigger institutes. I mean, there is so just see how many subspecialties there are for surgery. There will be that many subspecialties for pathology. So there is general surge, there is GI, there is hemat pathology, there is GU, there is derm and everything. I mean, it's okay not to come in with a firm idea that what subspecialty that you want to go into, but if you have an idea, that will always be beneficial. And I mean, I'm going to be doing a hematopathology fellowship in 24. I'm still thinking of doing a second fellowship or not. And the other thing is that my decision was, the spur of the moment, because I decided I had to do pathology. I had already wasted that much amount of time. So I just took whatever opportunity came to me in terms of research. So I didn't look at visa at that moment. I just took stuff that I was getting. Like I took my research on J1. And I mean, although the situation is not bad, I mean, but J1 is a very restrictive visa. So if you can, and if you have already thought about going into pathology, look for places that give you H1B visa, because that is something that, if I had realized earlier that I didn't like clinical work, I could have spent more time and, gone for places that have H1B visa. And and so that is really helpful later on. So I mean, plan that as well. But if you can't, like me, it's fine. I mean, I'm still happy on my J1 visa. I mean, I will have to find a waiver job later on, but that's for later on. I mean, I'm still enjoying my residency. I'm doing my fellowship, and I'm also looking at places that, looking at going towards places that have J1 opportunities there. So you can talk to people around and you can know, and you'll be surprised to know that, I mean, places like Manhattan is an underserved area. So, and that places it's like Manhattan, it's in the middle of New York, but that place can also give you a waiver job, but that's for later on. So, I mean, that's what I would have to say mostly. And if you have any questions, I would be really happy to answer.
Thank you so much, Dr. Khanna, for sharing these unique insights and also being very candid about your journey, through residency. So that's a very original topic. Next, I would like to introduce Dr. Mohamed Omer. He's PGY2 at Brown University. His interests in specialty of pathology are molecular genetic pathology, dermatopathology, and he plans to establish international comprehensive molecular genetic laboratories in future. He enjoys playing calisthenics, sport, personal training, and learning car mechanics. Welcome, Dr. Omer. Floor is all yours.
Thank you, Kevin, and hello, everybody. My name is Mohamed Omer, and I'm originally from Sudan. I practiced medicine as a general practitioner. My route to pathology is a little bit different than my colleague, Dr. Anurag and Dr. Rahul and Dr. Anurag. I was practicing general medicine as a family medicine. They call it back home as a general practitioner, and also practice as emergency medicine for a couple of years. Then I got the green card. That I decided to move here to the United States. But when at that period of my life, I was getting not bored, but actually satisfied by the clinical work that I did. When you start something, especially in the family medicine and emergency medicine, when you start at the beginning, you're like very excited, treating patients, seeing outcome, going forward. But after certain points, at a certain point of my career, I just realized that there is a repetition for the cases I'm seeing, and my passion start to abate away. So I was starting to look into something really exciting me, something dig deep in the diseases, not just treating the patient and with the similar outcome all the time. So I started looking for something around. I did not have any, when I started that time, I did not realize what is pathology entitled, what is the practice of pathology. Everybody coming from our school is thinking about the pathology, the way that we handle pathology in medical school, which is pathophysiology, was 100% different the way that pathology is practiced. You know, plus the step one, which is all of us, most of us has a trauma from it. You know, the fact that, you know, we read this stuff and I was like, oh my God, how can I memorize Vimington and Disman and all this stuff? That's crazy. And I'm going to go to a specialty. No, I'm not going to do that, right? This is one of the big myths about pathology. I'm telling you from now. So I decided to, you know, I went to graduate degree. The first one was in master degree in healthcare administration. By the end of it, I took a course in healthcare informatics. And the professor of the healthcare informatics, interestingly, he was pathology informatics. And he was my get to the pathology. He introduced me to something called precision medicine. This initiative has been established by Obama and is considered the biggest or the second largest project in medicine after the genomic mapping, which is finished in 2020. And the idea behind it is to create what's called signature, genetic signature for everybody in the United States. So in the future, and that's gonna be, it's not a very foreseeable future, it's gonna be very, very close future, by the way. In the future, when your doctor is going to prescribe you a medication, for example, metformin, right? The EMR is going to pop up and they will tell him, hey, this person has this type of genetic material, which is going to increase the risk of taking metformin. And guess what? The people who doing this in the background are pathologists. Whether going to be molecular pathologist, pathologist informatics. So here I start discovering what pathology is. You know, it's not just you know, like it's not just histology and you interpret it. No, it has to. It is a very, very diverse field that you can imagine. I pursued another master degree in pharmacogenetics, which is focused on molecular genetics. And from here, I realized this is the specialty that I go to. And speaking forward from this, to touch a point about the personality. A lot of people, they have the myth about pathology that's, oh, you are the person who's gonna sit behind the scope and look in the, you know, in that dark room, in the corner, doing this stuff alone for the whole day and go home. No, this is a very, you know, interesting myth. To be honest, I was, you know, also having this in my head. That's what the pathology do, but the reality is totally different. And I want to emphasize on that. Why? Because there is a lot of people comes to the interview season. They say, oh, we like to be a pathologist. Why you want to be a pathologist? Because yeah, we don't see the patient. If you say this to any program interviewer, you're gonna have a big cross over your application, because believe it or not, the amount of the communication you have in pathology is way higher than just communication you and patient. You're going to be communicating with the whole team. And by the way, that's what I like about pathology too. Once you graduate, especially in the clinical pathology, you're going to be automatically a leader. A lot of positions, they start by directorship or associate directorship, which is not a lot of specialty over that, by the way. Like I have a friend of mine who graduated from transfusion medicine. He just got a job at UC, University of Rochester, as associate graduate. Not a lot of specialty over that. Do you know what does it mean, associate program director? That means the amount of the communication that you're gonna deliver is supposed to be sophisticated and with a wide variety of people. The fourth thing that I like about pathology, it is immune in terms of there is no mid-level in our specialty. It means that look at other specialty, they have like, there is interference of nurse practitioner, midwives, and those stuff. In pathology, you don't have this. Pathology is for pathologists, period. You are not gonna find there is a school called pathology assistant, and by the way, it's a very lucrative career, but it's still pathology assistant. They cannot take pathology job. That's why I like about pathology. It's something, you know, in terms of that period. We talked about the personality, why pathology, and the market. I think Lahore touched a little bit, and I want to emphasize it. In the last 10 years, there was a myth about the people, they do not get job, despite everybody who graduate from here get job, okay? But in terms of something that we do not, it is very sensitive. It's considered taboo in medicine, which is finance. Oh, pathology, they make less than other people where they work harder, and pathology, they don't get job. In the last 10 years, between 2010 to 2019, that could be the case, but by the way, not the majority of the people. People find the job at the end of the day. But it was the case because not the decreasing of the volume, because pathology has been through a very differentiation period. This period where the molecular pathology got deep into pathology. At this period, the people who used to hire general pathologists, they still want to hire general pathologists. They don't want to go with a pathology specialty. While pathology right now, it's very difficult to find somebody called general pathologist, not 10 years ago, because in the last 10 years, pathology has changed dramatically. Like I can tell you 100%. I think Khanna and Dr. Anurag Khanna is going to heme pathology. And anybody in pathology world, especially in hematopathology, he knows the fight that's happening right now for establishing WHO guidelines for hematopathology. I guess, right? The WHO Blue Book, WHO Blue Book is the Bible for pathology in terms of oncology, right? There is a fight because they cannot even establish, they cannot even agree. That's just to show you how pathology is changing dramatically. What does it mean? Secure job for everybody. The biopsy and the direction toward precision medicine is increasing the volume. That's what yeah, the last point I want to speak about is the diversity of the pathology. And this is one of the things actually you do not find a lot in other specialty, that our colleague here touched a little bit, which is I am also thinking about it. We are not like, for example, other specialty where if I go to general medicine, for example, GI medicine, I cannot do something else. No, here in pathology is different. I can do hematopathology and I can do something like a GI pathology or GI pathology with molecular pathology with something else, because there is pathology is very intertwined with each other. It does not mean you went to single specialty, you cannot go to other one. The pathology world is different, and that's what I like it. The diversity of the pathology. I can pick two specialty and enjoy working it, like Cyto and him, right? Despite some people might disagree with that, some people like, let me just focus on one and be good at it. Some people like, no, I want to see a variety of things. So that's what pathology offers than not other offer. I don't want to take more time for it from you guys, but I think pathology is very, very interesting field. The last thing, yeah, the digital pathology, it is happening very, very quick, very, very quick than everybody think. Like our chief pathologist, he just get hired. He said our goal by 2023 is to be digitalized. Right now in the pathology board, last year our senior, they said when they went and board, they did board exam, they took the microscope from the board exam. Do you know what does it mean taking microscope for board exam? That forcibly every single education institution has to go to that direction, period, right? In Stanford, they digitalized their world in 3 months. So I think within the next 5 years, it is going to be digitalized, at least 60-70%. You know, it is happening faster than we think, which is giving not only freedom in the work, but also increasing in the volume. It's gonna help us a lot, like, you know. So I think I hope that I didn't take a lot from your time. Thank you, guys.
Thank you so much, Dr. Omer. That was very insightful. Now we are open for questions and answers. So our first question to all of you is like, what compromises a good application other than a good score? So what can students do other than the scores to improve their application?
So I'll take it first then. Maybe we can all go through, take turns with the same question, because there will be different views, and people should pick up whichever they like, right? So according to me, like apart from the scores, and scores are important, but they're not the only thing, right? So like they are a plus point if you are going to match to one of the top programs for sure. But then even if you score a little lower on the sides of like 220, 230, it's not considered a very bad score. I am an exception at the Cleveland Clinic with a score of 230 in both the steps. When I asked around later, I found out that the average step score in my institute is 250. And that is despite me being a 230 and dragging them down. So probably they were all like in 260s and 270s. So in top programs, yes, scores are important, but then even a score around 220 to 30 is considered good enough for like most programs. In addition to that, and definitely if you score more than 250, that is always taken as a positive point in any residency application, including pathology. In addition to that, you need to show some pathology experience, right? So the best way is to have US rotations, US research experience. Currently, most programs are not allowing you to have an in-person rotation. You can still do virtual rotations because they are the only available options, and they are still considered good. So if a US pathologist vouches for you, if they like you in a virtual interaction, even your interviews are virtual, so everything has gone virtual. So they accept the virtual format of taking experience and getting recommendation from people. So that is another thing that you should try to get US experience. And no, most of the people have already applied. But then I will say it's not that people without US letters of recommendation or US experience don't match. Those people match as well. So low scores match, and the people without US experience match as well. People without home country residency, they also match. However, again, so that's what I was saying, like everybody has a different story, right? So somebody who has a home country residency experience, maybe that was the strongest factor for their match. Somebody else will have a high score. That is, so you need to have at least something that sets you apart from the rest of the crowd. So you can figure out your own way. You can get a US experience. You can get 3 or 4 virtual rotations and US letters. That can make you a strong applicant. You can get a research in pathology and have an experience of 2-3 years of working in pathology. That could give you can have a combination of either of these. And then you can, obviously, interviews are important. Even if somebody ends up with less number of interviews, if you perform well on the interviews, that is also a strong factor. If people remember you while ranking you, if you said something that echoed with them, you said something that echoed with the program director. So there is a lot of luck involved. So I would not give up, regardless of what profile I have. Like regardless, if I have completed steps and I have a heartbeat, I will apply. And because if you don't apply, your chances of match are 0%. If you apply, the chances are better than 0%. So I would take that. And there are good days for people, there are bad days. Your good day, even with a weaker profile, you can get matched. Like Anurag said, you should apply to as many programs as you can, within your, like, whatever you can afford. If you can afford, you should apply to the maximum number. I know there are some future applicants too in the mix. So for next year, you can apply on the first day. I know some people say it doesn't matter if you apply on the last day, but then I have noticed I have worked with a lot of students in the last 3-4 years. I've noticed that the number of interviews decreases by a certain percentage for similar profiles if you don't apply on the first day, because you never know. Some people just like to go and download the profiles on the first day, and then they might still interview you in the second round of applications, but then obviously they will come back only if they don't get their candidates in the first round of sending invites. So applying on the first day, according to me, is important. People can have different opinions. Applying broadly, you can cancel out some of the programs that always reject IMGs, and everybody knows them by now. So, you don't waste your $25 there, and you can also cancel out, big universities if you want, the ones that have a history of being not inviting IMGs or only inviting very strong candidates. I personally removed some of them, even though they were like the best, universities. But I applied to all the programs where I thought that there is like more than 0% chance of my match. And I applied to all of them. I applied on the first day. I applied so in my profile, fortunately, and it's all based on luck. I had everything that people ask in my profile except the scores. Like, I did not have good scores, as I already mentioned. I had 230 in both the steps, but then I had all other combinations working for me. I had great letters of recommendation. I had US observerships. I had a research experience of 1 year in the US. I had a home country residency. I had practice experience. So, despite me scoring low, it was possible for me to be where I am right now, despite, being one of the lowest scorers amongst my colleagues here. So different things work for you. You get a combination of any of these things, and then you can have a successful match. That's all from me.
I think in pathology, we get a varied mixture of backgrounds. So whoever you are and whatever you have been and whatever your profile is, if you decide that you want to be in pathology, just go forward and don't think, oh, I don't have this or I don't have that. Just build up your resume, build up your CV. If you want to be in a particular program, see, like Anurag said, see whether or not they take IMGs. Also reach out to people who have been in that program. If you think that they do take IMGs, see what their credentials are, talk to them, see if there is any research experience available or any rotations available. That is the most important thing. Like you can reach out to any program and ask them, like the most they can say is no. So, but you have to try, but don't give up and never ever give up. That's the most important thing. Like like Anurag said, there are few programs who really don't take IMGs, so no point wasting your money there. You have to check where you want to be. Like when I was applying, I wanted to be in the Northeast, so I applied to all programs in Northeast, and I applied to some other programs, scattered programs, which I think took IMGs, but that's all. So you have to focus, and you have to focus on your profile, and you have to focus on what is the profile of residents who are already there. So that is a very important thing to think about. Second, if you want a visa is the most important thing, like whether or not they give visa. Like, for example, I'm in New York. I'm on H1. So when I was applying for fellowship, I cannot apply to Cornell or NYU or Columbia. They don't really give H1, so I cannot apply there. So these are the very practical issues which visa holders face. J1 is a bigger disaster in terms of visa. Like, you're really stuck on it. First of all, you know that after you complete your fellowship, you have to find a job. What is it called, Anurag? I forgot. The
waiver job, or
the waiver job.
home
So
country.
like Anurag Khanna said, there are waiver jobs even in New York, like busy cities like New York. So you have to look for those. I remember one of my mentors, he said, oh, for waiver jobs, it's like a trickle. It just trickles, like you just look for that one drop of waiver job somewhere. So in pathology, that is the one thing which like drives IMGs away from pathology, the lack of waiver jobs. So think about that. Try and get into an H1. The reason why I chose, like when I was applying, I really was talking to Anurag and some of my other friends, and they said, this program, they pre-matched you, they give H1, take it, don't even think about it. And I think that is a good advice, because visa is a real practical issue. I know a lot of my friends who went on J1, like Anurag also, he had issues. He went back and then he was stuck for like a month or two, right? So and I know my other colleagues from Pakistan, they really could not go back, because when you go to Pakistan, then you getting back within that time slot of your vacation is very difficult. So other countries also have their similar issues. So J1 is already a difficult issue to like visa to work on for like waiver job, but it's also difficult in your every year when you go on vacation, you think you will have issues. So it has happened so many times that people don't want to go on vacation back home. So you have to think about those things as well. But try and find a mentor. There are a lot of people who are doing research. They will like when I was applying, I would apply to like 100 people every day for observership or something, and obviously 99 said no, and one on a good day would say yes, or most days they would reply back and say no. So you have to keep on applying. That's the crux of it. And don't be disheartened by anything. Just be positive and know you will do it. And if it might not happen this year or the next year, but it will happen. So it's painful journey in so many ways, but it will happen. So be positive, but know why you want to go into pathology, and know where you want to go, which program you want to go, which area of United States you want to live in. These are the very basic thing, and the most important thing is visa. Think about that as well. So that's my bit here. The mic is to you, Anurag, Khanna.
Right. So, I mean, in my opinion, I will just divide this in terms of what your situation could be. So if you are like a medical student right now who's kind of deciding whether to go into pathology or not, the question that you can ask yourself is whether you like clinical work or you don't like clinical work. If that's one big question, because just ask yourself that if for the next 40 years of my life, I don't see any patient, will I be okay with that? And that's one of the questions. But you will still be interacting with other people as well, but you won't see patients. That's one thing, unless you're in transfusion medicine. That's a totally different fellowship. But then the other thing is that while you're in medical school, or if you've just freshly graduated out of medical school, make sure to take the letter of recommendation from the HOD of your pathology department there in your medical school, and make sure that they know how to upload it on ARRC, and make sure they know how to make an account on ARRC, because it may surprise you. Many of our attendings don't know, and you have to actually go physically and make their account for them and tell them how to upload letters there. So when you're in the US, suppose you're doing an observership, that becomes very difficult. Somebody else might have to go. So just while you're in India, make sure that they know that you are applying to pathology in the US, and you would need a letter of recommendation from them. The second thing would be that, talk to, and if you really know that you are into pathology, talk to your HODs in your home countries as well. Sometimes they are in contact with some of the attendings in the US who can help you get an observership or a research opportunity in the US. So that can be one option. And then if you have not given your steps as of now, study hard and try to get good scores, although extremely high scores are not required in pathology and are not a necessity, but it always helps to get an extremely high score. And an extremely high is, I got my step 1 score that was not extremely like in 260 or 270, but I got a 250 score, and I think that helped in my residency application. But again, scores are not the only thing. So good letters of recommendation and strong letters of recommendation. It's not that, somebody's just saying, yeah, this is a good person and I highly recommend this person. I work with him. He's punctual. He's working. Not that. If they are able to talk about something specific that you did in your time there, that shows that they actually paid attention to you. So strong letters of recommendation are very important. Then in terms of the question regarding home country residency experience, yes, that helps. But it is not that, if you don't have home country residency, you won't match. I don't have a home country residency, and I matched. And it wasn't the only thing that they're looking for. But home country residency is a benefit because you have been working there. You can talk more pathology with them as compared to what I could have talked about. So home country residency is beneficial, but it's not the absolute requirement. Then in terms of the question, how can fresh graduates maximize their chances to match in a good program? So one would be, if you've not given your score steps, give your steps with utmost attention, get high scores. Make sure you have good letters of recommendation, at least from India, until you can go to the US and get more letters of recommendation. So you are allowed to upload 4 letters of recommendation. So my 3 were from the US and 1 was from India. So, I mean, it's not necessary that all have to be from the US. Then what else you can do is also on your CV. In the eras, I've seen now in some people don't include some of the experiences which you have done, thinking that that's not required in the CV. Like, for example, if you went to the pulse polio immunization program in India, that is volunteer work. Put that in your CV. That looks good in your CV, that yes, you've been involved in volunteer work. Suppose you have gone, as even if as part of your medical education, you've gone to a rural community and served there for some time, include that in your CV, that I went to this rural community, I helped them, I gave them lectures, I gave them this. That also looks good. So then research, in terms of research, yes, research helps you, because basically while you are doing research, you come in. First of all, research shows that you are interested in that particular field. You are interested in pathology. That's why you're spending 1 year of your life researching in that particular field. So that's why research is important. The other thing why research is important is that during your research, you come across different people and different people in pathology, and there you can get more opportunities. Like there, they can offer you observerships, they can offer you other projects which might be like smaller projects, but you can quickly work with them and meet more people and, you know, network and get more interview opportunities, or just go to a conference. Say, like, just they are going and they say, why not you come along with me to a conference? Just go to a conference and meet more people. That's why people know that, no, this is a person who's applying, who's interested, and who's actually doing research in that field. Then in terms of what PDs see in candidates, I mean, I am not a program director, so I can't, and I have not, as of now, sat in any meetings regarding how the candidates are chosen, but I can just make a guess. I mean, scores are initially important, but then after they have given you an interview, then scores don't matter at all. So, because then that's out of the question. Now you have been invited to an interview, and everybody who's invited to the interview is on the same base. And now what you give, what your answers are in the interview, those will help. So that's why I stressed earlier, also prepare for interviews. You should have an answer to everything that's on your CV. And also, I mean, and like simple questions like, why are you doing pathology? I mean, then you should have a good answer for that, because that's, first of all, not only for interview, you should know that yourself. Why do you want to do pathology? Because that is a question. And then why the US? Because that is a question as well. And because they say India has very good programs, or other countries have very good programs, why the US? So you should know that yourself, why the US itself? So, I mean, and in terms of, I mean, in terms of how can someone decide to do pathology residency? I mean, for that, I guess you would have to get an exposure to pathology in some way or the other. I mean, because if you're not getting enough exposure to pathology, I mean, I don't have a very good answer like how you can decide, because either you can go to some other hospital, or you can take an elective in your home country just to see what pathology actually is. And or work with the pathologist, just ask them that I just want to shadow you for these many days just to see what workflow is like. And then nowadays, what I've heard, like online programs, online observerships, like I've heard about something called Path Elective. They're offering online observerships as well. And then there is something called digital communications and fellowship pathology. I mean, digital communication and pathology fellowship and all that. So you can try for those things as well. And I mean, people say social media is not helpful, but I mean, social media is helpful if you know how to use it in the right way. So follow the right kind of people, show that you are there, and you know that will help you. And I guess that's my opinion so far. And I'll hand it over now.
So I guess my colleague covered everything here. I'm just gonna touch base on a couple of things. So I first of all, regarding the pathology is very, very weird specialty. It's not competitive, at the same time it's competitive. What do I mean is, they care. Yes, score is important, but they care more. They care a lot about the pathology exposure. If you do not have a pathology exposure, just try to avoid this specialty. You know, because you do not know what this pathology is. You do not know what is pathology. I think at least in our program, they literally filter based on the pathology exposure. So letter of recommendation right now, especially in a specialized field of medicine. One of them is pathology is getting way more weight than before. Step 1 is gone. No more CS. You had step 2. So where is the other weight go? The other weight of the choosing applicant is going for what they are in your CV. Your CV. So based on your application, what's in your application? 4 or 5 points: letter of recommendation, exposure in terms of experience, research, and volunteer and hobbies. Volunteer and hobbies, that's what match me, guys. Not a lot of people know how to speak about their volunteer. During the interviews, in my interviews, 8 hours, they were speaking about volunteer. You know why? Because this is the thing that shows your personality. But this is a whole topic that we can discuss it later. Letter of recommendation means experience. Now, means that you show desire in pathology. I think, from my humble opinion, pathology is very sensitive field when it comes to letter of recommendation and experience. What I mean is, even if you apply 4 letter of recommendation, okay, 2 of them from pathologists and 2 of them non-pathologists. Now, the non-pathologists, from my humble opinion, have to address the fact that you are looking for pathology. You know, otherwise they're gonna take something else. Why I call it competitive versus not competitive? Anurag and Laohori mentioned something very important, which is the score. And beside the score is not in pathology world, score is important, but pathology, as I said, is pathology experience is as twice as important. What I want to say is, once they interview you, right? That means you have a pathology experience, right? Then you do not know what you are talking about. Then you didn't pay attention for the pathology. Then they will not take you. Why they would do that? Because pathology most of the time are the small programs. What does it mean? We are like 3 or 4 in most of the residencies. The biggest residency in United States maybe 8, right? So they cannot compromise taking one who's not into pathology. Not even if he has 270. If you are not into pathology, that's a period for them, you know, because pathology is an extremely difficult field. Despite it's very intellectual, it's difficult, guys. We are in the level that we are talking about a knowledge, it's same knowledge of other fellows. Literally, like in hematopathology, when we rotate in hematopathology fellow rotate with us. You know, we are educated. They are educated about type of lymphomas, you know, or type of leukemias or certain diseases that general medicine they don't know it. What does it mean? You need to have a desire, because it is very challenging. Okay, so I think, from my opinion, exposure is the most important thing. Somebody asked, how can I get exposure? Pathology is right now is very diverse, right? I think one of the entrants is the forensic pathology, especially in the developing country. Beside the laboratory medicine, forensic is part of pathology in this country, right? This is one of the way you can see a broad spectrum about pathology. You can see anatomical and clinical in forensic. You know why? Because when they diagnose the patient, how they died, they will take cases and look at the microscope, slides and look at the microscope. And then at the same time, they will look at his clinical lab. What happened to this patient at the end of the day? I want to stress on a point that, yes, we do not see patient, but the amount of the clinical knowledge that you have to interrupt what the patient have been through, it is sometimes, I don't like you know, underscore other specialty, but it's very high, guys. So just put your budget around LOR. Experience, I think it's matter a lot right now for every single specialty, not just pathology, but for pathology especially. And good score in whatever score is it right now in step 2. I think that's it. The last thing I want to say is, Dr. Ruja, he said, like, when I got one interview, when the day I got one interview, guys. I have just passing score. Those guys, they have 230. Some people, they have 240. I had passing scores, right? When I came to Dr. Anurag, Dr. Sharma, and the first time, he's my mentor. And he said, listen, Mohamed, if you want pathologist, you will be pathologist. That's it. And that's what I'm saying, telling you guys. Regardless the specialty you want, just seek after it. There is no specialty right now. It's not competitive. Everything's similar, right? Just go behind it and be passionate about it, and you will get it. Be patient. I got from one interview, but when I went to the interview, I kill it. My program director, my social program director, till this day, they told me, we remember what you said during the interview, because I want it from the heart. I worked. That's reflected subconsciously during the interview. Okay, I guess I'm gonna hand the ball for our invitees.
Thank you, Dr. Omer, for being that honest and candid. That kind of steps me up to the next question. Like, we as applicants, all of us applied last week. So, what would be your tips and tricks to kind of increase the number of interviews and also have a better interview experience overall?
So I think give the program another week and start communicate with them. It's very, very important right now. The communication is very crucial, guys. Communicate with every single person. Right? Every single program you apply to. Once you got your interview and you done from interview, right away, thank him. Thank you letter right away. And then before the ranking, tell them that I am interested about your program. But right now, I think you just want to chill, relax, get back. If you didn't do step 3, just this is the time to do it. Even if you think that you're gonna, I have a friend, and when I match, I have a friend who did step 3 during the match season. And when he got the step 3 result, he communicated with the places that he interviewed with, and he got match in one of these places because of that. So if you don't need the step 3, of course this is the time. If you just wait, if you did step 3 and you're just waiting, communicate with them, and still keep going in your CV. Like if you're not doing research, communicate with the people research, communicate with the people doing elective, and go for it. One of the things that I want to just touch base on, if you are in the United States, clinical experience in clinical pathology or pathology, it doesn't have to be experienced inside university, guys. You just can reach out to the laboratory around you, right? Do not tell them, hey, can I do observership? No. Right? Laboratories, they need a lot of technician. Right? Even if you do not have a work permit, just tell them, hey, approach to them to the way that, hello, how are you guys? My name is blah, blah, blah. I'm interested in pathology, by the way, and international medical grad. I just want to, not observer, I just want to, help in terms of, being a technician or being a laboratory technician or observe laboratory technician or sitting part or something. I personally, I got a job through that. Like I was a laboratory technician when I was doing my master's degrees. This is another way going to introduce you to the laboratory work and get more exposure, right? How the pathology works, and actually you have ongoing experience in your CV, right? You are not just experienced at the level of pathologist. As I mentioned earlier, pathologist is a leader of a group. So you are having experience even at the technologist level, which is very, very important. It's not about diagnosing, guys, in pathology. It's about you can have a slides, have an issue, QA issue, quality issue, right? When you have experience at that level, you can solve the problem faster. That's what I'm saying. Just reach out to. There is a lot of laboratory around you, right? Just Google it. Where's the laboratory work? Regardless what type of laboratories, whether hematopathology, general surgery, oncology, site 2, clinical pathology with a clinical chemistry, just reach out to them. Hey, say, guys, I am interested in pathology. I'm international. I just want to shadow you guys. It's not just observer. I just want to shadow you. You can put that in your CV, and that's a plus sign too.
Sounds great. I mean, that's a great tip. Like, just continuing our work experiences. Any other kind of insights from other speakers?
Same, like I'll echo the same thoughts. Like you have to reach out to the programs, but then give them time to go through their initial list of downloads. You cannot do that on the second day of application because they'll be like, oh yeah, you're number 84. Why are you spamming me in my email box? And it's also very important to not not disturb the program coordinator too much, because program coordinators are important people. If you email a program coordinator 3 times a day, she will make sure you don't match to the program, right? So you have to be nice to them. You have to understand that do not call the program coordinators. I would say, you can send one letter of interest. You get like one time to reach the program, do it one time and do it in the best possible way. Make a personalized letter. Do not just make a template and send it to all the programs. Work for it. If you can afford to have a time, I think if it's better to send less letter of interest that are more personalized rather than sending a template to all 121 or 156 programs, because that, and then if you're making a personalized letter, make sure that you do not use the template of one letter as a, because we do that, right? We do not type things. So have a blank in your Word and, fill it every time. Enter the email addresses only after you make sure that you are sending it to the person that it is intended to. Because if you're sending, this is one way you can, pathologists are nice people. They do not usually red flag anybody, but you can red flag yourself by doing these activities, and you have to be really careful. For people here who are applying next year, should know that you should not submit a medicine letter of recommendation to a pathology program, and that is how you yourself unmatch yourself, right? So do not do these things. They're really important. Do not submit a pathology PS to internal medicine and vice versa. You can be a dual applicant. I don't mind that. We're like most people here are immigrants, and we know we have to have some tricks up our sleeves to survive. It's difficult for us. So I know people are dual applicants, but do not make the mistake of addressing somebody else, sending the email to somebody else. So I would say definitely reach out to the program. And like Mohamed said, when he was interviewing, I told him you should know more about Brown University than anybody in Brown University. That was what we decided, and we worked towards that. And definitely he knew more. And I went through the website. He went through the website, and when I talked to him, I knew that he knows more, like the most information about Brown. What Brown is doing outside of pathology, he knew everything. And you discussed about these things with the program director, and they were like blown away by his interview experience, right? So once you get an interview, and I always like, this is a like in a lighter note, when I said apply to all programs, it's like swiping everybody right on Tinder, and then so you do that without focusing on who's who, right? And then once you match, then you look at the profile, and then you go to the Pinterest of that person and find out everything. You know them better than them, and then you approach them, and this match is gonna work after that, right? So that is how you can approach it. And definitely come to Twitter, follow the pathologists who are active on Twitter. There are 30% of pathologists who love Twitter. There are 30% who are ambivalent, they don't care. And there are 40% who hate Twitter. So, you have to have the feel. Like I heard one of Mohammed's, interviews of how to prepare. Because I keep learning, I teach, and then I learn from the same people again. That is how I operate. So he was telling you have to have the feel of the room. Like you have to feel the interviewer. Like when you are with a person, you have to know, immediately try to understand like what to say, what not to say in front of whom, So all these techniques can help you, improve your chances after you have applied already. So that's my 2 cents.
Thank you so much, Dr. Sharma. Again, reading the room, getting feel of the interviewers. My next question is, like, every specialty has a specific personality trait, right? That interviewers look for. What would be that personality trait in pathology that programs look for in candidates?
I can take that if it's okay.
Yeah.
In terms of personality trait, I think most of the programs is looking for that you're actually interested in the field, because unlike some of the other specialties, where they know that, I mean, you are interested in the field because you're only applying there. And pathology kind of has that reputation that some people just use it as a backup option. But so you have to, I mean, so they're looking for people who are actually interested in the field of pathology. I mean, and they should have, their CV should speak to that, that they're interested in pathology. And the second thing that they're looking for is like a person who will gel well with the program. I mean, who will fit well in the program. So, I mean, and as Omar mentioned as well, that there are most of the programs usually at max have 8 residents in them. So you have to live with these 8 people, unlike as compared to, say, a clinical program where you have 40 residents. So you keep on shifting around and that doesn't matter. But you have to live with these 8 people, and there will be 8 people in different batches as well. So even if one person creates a ruckus in the program, like a person who's not dedicated, who's not doing their growthing well, who's leaving work for other people, they don't like those kind of people. And it's very important to, you know, show that you are a team worker, that you are a person who likes to work with other people as well. And the other thing is that pathology is a small world, you know, and then all pathologists kind of know every other pathologist in some way or the other. So, I mean, in your interviews, try to be humble. Don't try to, you know, boast yourself or, you know, show that, yeah, or, and even your body language as well. Like, I mean, if you're sitting, sit with a straight back and have a smile on your face, and not, you know, these are small things, but this is important because that can give you, like, I was hearing other people, like that person was sitting like this in the interview. Since it's being virtual, people don't realize. And if you are dressing up for the interview, dress up for the interview. Don't wear shorts underneath your coat, and, you know, where just dress up properly and have a proper attire of speaking, as well as, you know, and listen to the other person who's talking as well. Another important thing that I wanted to mention was, when you are submitting your rank order list, when you've decided and when you have interviewed, if you are telling a program that in your letter of interest that you are my number one choice and I'm very interested, make sure that you are putting that program as the number one choice. Because if you don't match there and they really like you, pathology is again a small world, and like that person has said something and I didn't get matched something. So first make sure that your rank order list is fixed, only then send out letter of intent saying that, you know, I'm highly interested in the program. Because, you know, programs cannot say as per the regulations that, okay, we'll be ranking you as number one or something. But you can show your interest that I'm highly interested in your program. You can also not say that, you know, I want to be there, please give me an interview or something like that. But you can show your interest that, you know, I am highly interested, my interview went really well, and I'm looking forward to the opportunity to working in the program. So that tells a program that you have ranked that program pretty high. And programs might just send you a generic reply, good luck, because that's what they can't really disclose their rank order list before that. But I mean, that's one other thing that I wanted to add. And I mean, in terms of sending letters of interest, as Dr. Sharma said, that, you know, don't have generic letters of interest. Read about the program, include specific stuff in the letter that shows that you have read about the program and you're genuinely interested in that program. And that's, I mean, and sometimes letters of interest just work in ways that, you know, that that program is not going to offer you an interview. So I sent out letters of interest to some of the very big programs, but I at least got, I mean, that was just a way for me to get closure. Okay, that program is not interested in me. I can just take my hopes off the program. And, you know, and also it also gives you the satisfaction that you tried your best. You applied to the program, you even sent them a letter of interest, that you won't be, you know, in a regret later on that, okay, I could have done this and maybe they would have sent me an interview. No, just send a letter of interest earlier. I mean, wait 1 or 2 weeks, and then if you're really interested in that program, send a letter of interest. Otherwise, I mean, yeah, prepare for the interview, and don't look like, you know, that you're not interested in pathology. Because I had one weird interview where, I mean, they actually asked me to look at a slide during the interview. Don't be scared about that. They're not expecting a diagnosis during the interview. I mean, this won't happen now. Mine was an in-person interview, but I mean, this won't happen now. But still, I mean, they will try. Some people may try to, you know, off-put you. Just be calm and composed and be chill. They're not expecting you to make a diagnosis or make a decision at that point of time. So, I mean, yeah, that's the That's my opinion here.
Thank you so much, Dr. Khanna. That was very insightful. I have a question for all of you, Dr. Khanna, Dr. Sharma, Dr. Omer, and Dr. Laohori. You have all had your own unique journeys. So if there was one thing about your journey that if you could change, what would that be?
For me, in one word, persistence. That's it.
Okay.
One word, persistence.
Thank you, Dr. Omer.
I would start preparing for the USMLE steps during my MD in India. I think I wasted like 2 more years by trying to finish my MD first, because I was of the view that I should have something in hand before I go for the next thing. I think that kind of, added 2 more years to my already very long career. This is my 18th year after I entered med school. So I could have liked it to be like my 16th year. So that's the only thing. I don't have a lot of regrets, I would say. I'm overall, I think I'm grateful and I'm happy to be where I am.
Thank you, Dr. Sharma.
I think one more thing which a lot of program directors told me when I was applying is that, have you done step 3? I would say try and get your step 3 done as well. A lot of programs feel very comfortable about candidates who've already gotten step 3 out of the way. So that is also one thing you should really focus on right now, because right now when you have applied, you've already taken the step 2 and step 1, obviously, and you are ECFMG certified. So if you've not done step 3, do it. That's very important point. And when you do it, just send in another like email to the programs that I already did step 3. So that is also one good way for them to like reconsider your application if they have not already considered it.
Thank you, Dr. Laohori.
From my side, the only thing that I would like to change would be realizing earlier that I like pathology that much, and secondly, going for an H1B opportunity than J1 opportunity. Because life is still pretty good. I'm enjoying myself. It would just take off an additional burden that now I have to overcome to get the green card and everything else. So that's the only thing that I'd like to change. Otherwise, it's been nice.
Thank you, Dr. Khanna. So one of the questions that we have coming in the chat box is that if people have already done a home country residency and if they're switching specialties, or if they have a pathology residency, do the programs think that they can't learn and relearn it again? Does that become a weakness for them?
Well, I think I can throw a couple of words here regarding whether you have a specialty back home, either in pathology or not. By the way, it is related to the program committee thinking. Some program would prefer someone with residency back home in pathology, and some of them would prefer to train someone who has not have been through a residency, just an experience. The thought behind that is some people with a back home residency, they got in the residency here. They thought that they got a residency here just because of to be a pathologist, because there is no other routes in this country to be a pathologist other than to go to this. And your residency, they had like a conflict with the attendants. To be honest, in our program that happened. Like a person who has a residency back home in pathology and he got a residency here, the idea is like he's gonna be advanced, right? But that's really to conflict with other attendants. Like, hey, don't, like they have the thinking that, I am not a resident anymore, but I am a resident. So there is a two-way in dealing with this here. Regarding other specialty, if you have other specialty, pathology is one of these specialties that people come to not going on. I rarely have seen a pathologist leave pathologist, but I see people coming. It's okay, but you have to reflect why you are coming pathology from other pathology. Like if, for example, if you are surgery, like I have one my mentee right now, he's coming from surgery, and he said, I want to be a pathologist because I have been exposed to surgical oncology, which is part of the pathology. So you have to see common background, but please do not go to the interview and say, oh, because I don't like seeing patients. That's a big no-no. That's my just.
And I would like to add that if you are already home country trained, then the only way you can harm yourself is by showing that you don't need training and you're here just because you want to immigrate. I think that is also not true, because you learn a lot even after a residency. Even if you do your residency from AIMS or PGI or any top, Aga Khan University in Pakistan, like even if you do it from the best in your country, you will still learn a lot in your second residency. And you should make it clear, especially when talking to the residents. You should not. I used to talk about general things, what's the rent, and how far is your commute and stuff like that, instead of talking to them about my pathology experience. And to the pathology attendings who would be my interviewers, I would talk more about my pathology experience, because I knew that I'm not going to intimidate them with my pathology experience. So because they want somebody who would fit well and who would work well with the team. That's the numero uno, the thing that they want. And if you come across as a person who's not willing to learn, even if you are like the best pathologist from India, Pakistan, or Bangladesh or wherever, they will not entertain you. They want somebody they can work with. So be grounded and know where to talk about your experience and where to skip it altogether. I would not talk a lot about my past achievements with the residents who I would be working under. I don't want to intimidate them. That is one way you can harm yourself if you are already trained back home. I think we can do like a rapid fire. You can ask us, one of us can take and do a 10-second answer now, so we can quickly go through all the questions.
Thank you so much, Dr. Sharma. I can start with rapid fire round. So my question, I can ask you this question. What would be one thing you wished more applicants knew while applying? Because you have worked with multiple students. So what's that one thing that you think everyone should know before applying to residency in pathology?
Applying early, applying to a lot of programs, sending letters of recommendation, sending letters of interest when the time comes, and not spamming the program coordinator, and being nice to everybody, be grounded, and don't compare yourself to the other applicants. That's another thing that I want to tell everybody, and it applies on each one of us. Even at this stage, like we compare where are people getting jobs and where am I getting a job, how much they are getting, how much we are getting. Everybody has a different story. Just do your own thing. That is what I would say.
Thank you so much, Dr. Sharma. On to you, Garima.
Thank you, everyone. That was very insightful. So our last question for which everyone is like asking is, like, now they are all set and people have applied, you've gone for the interview. One final tip that you can just give to all the applicants who are going to interview this season.
Like, if I can say something, just have a positive mentality. Do not get fooled or by the people talking around you. Like, you are not gonna do it. And when I applied, everybody tell me, hey, with your score, with your credential, you are not gonna even make it anywhere, right? Just tell anybody will tell you such negativity and thank you and move. Have a positive mentality.
Thank you, Dr. Omer.
Also make a list of questions which are always asked. Like when I went through all the interviews, everybody asks questions from a set list of like 90% questions are all the same. So just write down your answers, know what you want to answer, and prepare ahead. Just know those questions because they're all posted in all the forums. So if you just Google search it, you will find them, and write down your answers, prepare your answers well, sit down with a colleague and like verbalize it, like how you would present it, how you would present yourself, and be very confident. And that's the most important thing in an interview. Be humble, be polite, be confident, but know why you want to do this. It shouldn't be like, oh, I don't know why I want to be here. You should know why you want to be there. That's very important.
Thank you, Dr. Laohori.
And sorry, I would just like to say that also have questions for the program as well. And those questions should be tailored to the program. And even though the previous interviewer answered all those questions for you, ask the same questions to the other interviewer as well, or ask some other questions, because it doesn't look good if you say, okay, I don't have any questions for you, because at the end of each interview, they'll say, do you have any questions for me? Always have questions, but not too many as well. Just 1 to 2 questions. That's like a good balance that you have. You show that you're interested in the program and you know about the program as well, and practice before going to the interview, practice the questions and make sure that you have it should be spinal at that level, like you shouldn't have to think about it. Your answer should come out. Even if somebody woke you up at 2 a.m. and say, okay, why do you want to do pathology? Your answer should come out like that. So, I mean, prepare it that well. So
Ask them about like, where do people go into fellowships? Do you guys have mentorship opportunities? Do you have research opportunities? Like, and ask the residents. They always will give you the right side of the program in like candid moments. They will. So ask everyone and make a list of your questions. Like Anurag said, it's very important. You should not be like deer in headlights situation at that time.
Thank you, Dr. Laohori.
Practice again and again,
Okay.
just stand in front of the mirror and practice all the questions. Know your CV, know your PS, know your own story. If you have lied in the PS, start living that life. That is you for the next 3 months. Do not contradict yourself, your own PS and CV. Practice with friends, and be hopeful, like Mohamed said, and just everything will be all right. I can put my Twitter handle if you have any follow-up questions. I'm always available. I'll try to answer as much as I can. So, yep, that's all from me.
Thank you so much, Dr. Sharma, Dr. Khanna, Dr. Laohori, and Dr. Omer. It was a very candid and insightful session. I think a lot of the students got to learn so much, and the applicants who have applied or who will be probably applying next year into pathology, they learned a lot. So thank you so much for your time. And if you could please put your Twitter handles in the chat box, so if any students had any questions, they could contact you.
Thank you. Thank you for having us.
Thank you again
Thank
for
you so much.
taking time out for us. Thanks.